Hello, we're here today to provide an update on the COVID-19 disease and share information about Silver Cross Hospital's efforts to contain the virus and keep our community safe. And with me today is Dr. Atul Gupta, who is the Medical Director of Infection Control at Silver Cross Hospital. So let me begin by thanking you for your leadership and for your guidance. You've been with us every step of the way. And I just want you to know how much I appreciate your ability to explain clearly, to keep us calm and help us as we tackle this challenge. So let's just start out with the status. What's going on at Silver Cross, and have we seen COVID-19 cases?
Right now, at Silver Cross, we have one confirmed positive patient as an inpatient. We have one patient who tested positive as an outpatient. And there are 4 inpatients that we're still waiting results for.
Right. And there's a lot of confusion here at the hospital and also in the community about testing. So what's your advice on who should be tested and where should the testing be done?
The current recommendations for testing include patients who have risk factors to have the disease or to have serious complications from the disease. Those risk factors include travel to a place known to have widespread community spread, contact with a known case of COVID, people who live in nursing homes or other healthcare facilities, and patients who have risk factors for serious complications like advanced age or underlying health disease. Those all become important if a patient is symptomatic. If someone's not symptomatic, then there is no recommendation for testing.
Okay. So not everyone in Illinois can be tested.
Absolutely. At the present time, we don't have the ability or the need to test everybody in Illinois. We're prioritizing patients who have those risk factors or known contacts.
That's really helpful to know. And then if someone thinks they have those symptoms, what should they do?
The first thing they should do is they should contact their physician, and their physician will, on their behalf, or they'll direct the patient themselves to contact the Will County Health Department. And the Will County Health Department will provide further direction at that point as to whether the patient needs testing. And if so, then they'll direct the patient where to go for testing.
Okay, that's really, really helpful to know. And just to add to that, if Will County decides a patient should be tested, they call Silver Cross, they give us the patient's name, we call the patient and get their license plate number and have them drive up near the emergency department, and we actually do drive-through testing. We take the swab to nasal swab in the person's car, so we're not contaminating other people in the hospital if this patient does turn out to have the virus.
That's right. And it's important to note that testing is only for patients who have been approved for testing. That drive-up testing is not open to the public at the present time.
Thank you. Thank you for that clarification. I know we're seeing a lot of things about drive-up tents, and it's not. Okay, good. So let me ask you, should I be wearing a mask all the time?
No. The spread of this organism is not such that people coming into casual contact with other people are at any risk at all. The primary mode of transmission is through respiratory droplets when someone sneezes or coughs. And really, you have to be in close contact with someone who has the disease for a prolonged period of time. So passing someone in the hallway, at the grocery store, or certainly even outside, you would be at no risk of catching the disease.
Okay. So for example, you are seeing these patients in our hospital, and I'm sitting by you, and I'm okay.
That's right.
Good to know. What's going on with supplies and test kits and masks? There's a lot of concern in the newspapers about this.
Nationwide, there's shortages of all these things. Here at Silver Cross, we have a supply, and we're taking active steps to manage that supply so that we have enough to meet the needs going forward, and at the same time protecting our patients and our staff as best we can.
Okay, sounds good. You know, it's interesting. We put out a plea to the Three Rivers Manufacturing Association for N95 masks, the industrial ones. And we've gotten great response, so thank you. And we'll use these as backups if our N95 masks are in short supply.
Yeah, that was a great development when the CDC cleared non-medical grade N95 masks, which should be perfectly acceptable for this purpose. It'll really help us with our supplies and, again, protecting our staff and patients.
Exactly. It's great to have that kind of community support. So what are we doing about visitors at the hospital?
At this time, for the health and safety of the patients, the visitors, and our staff, we're restricting visitors to only certain types of patients, OB patients, pediatric patients, and then in certain cases for other patients if it's deemed necessary.
Okay.
Other than that, we're not allowing any visitors at Silver Cross, again, to protect the community, our patients, and our staff.
Right. And with information changing so rapidly, I would really recommend that people check our website to see if they can visit or not visit, and check there first before you make the drive over here.
And if you're planning on visiting, please call first and make sure that you're going to be approved to visit before you come to the hospital.
Right. And if somebody is an approved visitor, what will happen when they come here?
The approved visitors will come to the front desk and they'll be screened to see if they have any risk factors or symptoms. And if that's the case, then they'll unfortunately be turned away again out of an abundance of caution. And if they're approved to visit, then they'll be given a pass and they'll be allowed to go visit their family member.
Yeah, really good policies and procedures to keep people safe. And what about surgeries, elective surgeries? What are we doing?
At the present time, in order to concentrate our efforts on making sure that we're prepared to fight off this infection and to protect the health of the community, we're limiting the number of elective procedures, meaning non-urgent procedures, certainly things that need to be done and that, as determined by the surgeon and the patient together, will still be done. But everything else that can be delayed for now, we're delaying. And we've had a lot of great cooperation from medical staff.
Okay. And we'll be able to reschedule patients later in the year as things change. So let me ask you another question. Is it safe to go to the grocery store? Can we go get food?
Absolutely.
Okay.
I went to get food yesterday, and I went the 2 days before that. Certainly, you have to take the precautions, clean the cart off, and try to limit the number of things that you're touching in the store. But again, continue on with those activities as you would have.
This is not meant to be funny, but did you find toilet paper?
Fortunately, I had bought some just before all this happened, so we're
right.
okay for now.
So another question we get a lot, is it okay to visit elderly parents?
I've been telling people that they should take that as a case-by-case basis, their own personal comfort level. Certainly, we do know the number one at-risk group is the elderly. But again, if you as an individual don't have risk factors for having the disease, and you can visit your family to keep them safe, a lot of people are recommending that instead of letting your parents go to the grocery store, go to the grocery store for them and bring them the groceries. So I think that kind of family support is very important right now. Very
important. People get lonely.
Absolutely.
Okay, so in general, do you think we're making progress on this virus? Do you think it will end soon? I
think right now it's too early to tell. I think we're at the point now where we're starting to see more cases faster than we were before. So again, that's the reason that we're taking all the steps we're taking, because we don't know what's going to happen. We want to be prepared for it. And I think in the next few weeks, we'll have a really good sense of how things are going.
Well, thank you, Dr. Gupta. The information is so valuable to our community.
My pleasure.